until 2007, the Prime Minister recognized there was a need for more. There was a need for a transformation of healthcare to achieve Vision 2020. And what is Vision 2020? A nation empowered to live long, happy, healthy, productive lives. So fulfilling the political leaders' mandate for our 2020 transformation in healthcare, we, upon the new office, started to consult immediately with all stakeholders. And through this process, we developed short, medium, and long-term plans so that we can attain the Vision 2020. And from the outset, I can say with great conviction that this government's commitment to this transformation is visible in the investment government is making in health. I want you to be mindful of that because they will give you all kind of old talk. But you have to know, in 2007, the government put 2.9 billion in health. 2008, 3.3 billion in health. 2.9, 3.5 billion in health. And I'm sure the Prime Minister will treat us well this year. This government continues to increase the budget allocations to healthcare because we are taking your healthcare needs seriously. So as we account, let me give you some of our short and medium-term successes since 2007. So let me tell you, don't let them give you no old talk. When they come to give you old talk and they ask them what we achieved in the last 2 years, you tell them we delivered a new oncology and dialysis center at Sandy Grande, that we gave free glucometers and testing strips. You tell them when they ask you about the shortage of doctors and nurses, tell them about the 119 specialists, foreign doctors, and the 450 nurses who have already started to arrive. Tell them about the 1,510 students training in nursing programs at cont'd and the Ministry of Health, so we will not need foreign nurses. Tell them about the $100 million in scholarships to train locals. Tell them about that. PNM being their brothers and sisters keepers. And when they ask you about emergency health care, you tell them about the 811 number initiative and the increased number of ambulances and EMTs and so on. And we now responding between 15 and 31 minutes. We know it have the odd occasion when we go a little longer, but on average, that's what we're responding to. And you tell them about the legislation we just passed, which the UNC vote against, and, well, are wrong. Not all of the UNC. Part of the UNC vote against, and the other part vote for. When they ask you about cancer, tell them about the new National Radiotherapy Center. You mightn't know this. Thank you very much. Thank you. We now have the best cancer treatment center, the NRC, in St. James. It's been completely refurbished. It's now the best in the Caribbean, and it now offers a full range of services. So we know when they ask you about health initiatives, tell them about our tissue and organ transplant program, and tell them about the enhanced cancer and dialysis programs that we are running and so on. So that is just to name a few. And when they ask you about beds, tell them we just delivered on a new neonatal ward in Port of Spain, a new orthopedic ward in Port of Spain, a new pediatric A&E department at Mount Hope, a new pediatric specialty unit at Mount Hope, a new ward in St. Anne's, an enhanced Oxford Street Health Center, the Barataria Mental Health and Wellness Center. You tell them that. Tell them about the Sawa Health Center, the Debe Health Center, the St. Madeleine Health Center, the La Romaine Health Center, and the St. James District Health Facility. And tell them, and that is in 2 years, in 2 years. So tell them, don't try that. We know what's going on. Tell them that we give 21.6 million in 2007 alone to help people in order so we can demonstrate that we are our brothers and sisters keepers. But you know what happened? You know why they get on wild so that some vote in one way in the same party, the other voting? They're running scared because they're looking around Trinidad and Tobago and they're seeing Vision 2020 coming into reality, they're getting frightened. They're getting scared. And let me just talk about health. Let me get a little comparison. In 2001, they were only able to do 19,000 surgeries. By last year, we did 27,000. In 2001, they had 1,200 doctors. We now have 1,700, and soon we'll have 1,900 doctors, from 1,200 to 1,900. Nurses, they had 3,005 in 2001. We now have 4,800. So our admissions have increased. Mount Hope up by 147, Sandy Grande 56. And you know, they like to give you all this old talk. Infant mortality, about children dying and so on. It has decreased in Port of Spain General by 34%, in San Fernando by 36%, and in Mount Hope by 45%. So I want you to have the figures, so that when they talk the old talk, you can take your phone, call the radio station, and tell them they're talking nonsense. We now know better. But ladies and gentlemen, this is some of what we have done. But as much as we are proud of these achievements, and as much as all this meets our short and medium-term targets, the transformation of the health sector is certainly not yet finished. We acknowledge that there is a lot of work to be done, and we are doing just that. So that when the Prime Minister said, do a transformation plan, we came up with 3 strategic objectives, and I always like to share these objectives with PNM people particularly, so they will understand how their faith has been placed. Because we are looking at prevention and promotion of health. And that is to make sure you do all the right things and prevent yourself from needing health care. We are looking at a first world healthcare delivery system, and that is to create a system that is ultra modern and consistent with the first world, and an efficient state-of-the-art public health system, and that's to make sure all those vector-borne diseases, dengue and H1N1 and so on, we have it under control. But you know, those are big things. What you want to know is all this big Vision 2020, all the strategic objectives, transformation plan and so on. What does that mean for me? You want to know that. Well, let me tell you. It means a new experience in healthcare. It means faster service at the healthcare facilities, an expanded range of services, a modern, well-equipped primary care center accessible by every community, point-of-care testing with results within 24 hours, going into health institutions that are modern with the latest technology and equipment. And I can tell you, the Scarborough Hospital is going to be finished in April of next year. The Point Fortin Hospital will start in the first quarter. The dialysis centers and the oncology center will both be recommenced and started in the first quarter. So we are on track. And we are coming to Arima and we're coming to Sandy Grande. So it means shorter waiting periods instead of months or years to get a surgery done. It means world-class standards in all healthcare delivery. It means working with you in your communities so you can take care of your own and your family's health, being our brothers and sisters keepers. So what we are going, and I'm going to tell you very shortly what we'll do that very briefly. It means training and motivating healthcare professionals to treat you with the love and respect you need. It means converting your fear. When you go to a health institution, you're frightened, you're worried. We know that. And we want to move that fear into hope. And we want to treat you with care. So in other words, it means every single citizen being assured of caring health care regardless of race, religion, or economic status. But as much as we bring you services, you must play your role. You heard what the Prime Minister said. He said you have your Bill of Rights and all that, but what is your responsibility? Dr. Dickford for Planning, Housing and Environment, she said Vision 2020 accrues responsibility to communities, to villages, and to individuals. And I joined in that call. So as much we want to say we stand ready to assist, but we don't want you to just live longer, You know why we care about you? We don't want you to just live longer. We want you to age better, to feel better, to feel stronger. So if you listen to the advice that we're giving, then that will happen, all right? And that is why it is so important for us to take personal responsibility